Sixth floor space. This is really more so our simulated hospital space.
Right.
And then we have a few different technology trainer rooms and that sort of stuff in the back. So we'll walk through this and I'll kind of show you back down that way.
Okay.
So in here, a few of the specialty rooms that we have are related to trauma. You were just in the acute care room at ICU. So this is actually a trauma, or what some might call like a stay room. Well, the last one that we did in here was actually transfer from EMS to surgery for a general surgery interest group night. So I had to treat kind of a femur fracture, tension pneumothorax, such like that. And then as we walk down this way, now this room isn't going to be set up to what it typically is, but this is one of our ORs.
Nice.
So you can kind of get the idea of what it would look like. As we get to the other side, I'll show you one that's fully set up for one of our anesthesia sims. But right now what we're doing in here is kind of reformatting it to accommodate for spreading out for COVID and actually being able to still hold our surgery classes for suture practice. So that's why you'll see the tables in here and such. Yeah. So we have everything from laparoscopic towers in these rooms, the ventilators, the anesthesia machine. Trying to think what else capability-wise. And as we walk back this way again, this is our acute care ICU, and then this is meant to be more so a nursing station.
Right.
So if we had like a tele hooked up or anything like that, they would have monitoring up there that we could display, and then they could come and get their orders. And the whole idea of this center is to really be interprofessional education. So trying to mingle together surgery, nursing, EMS, all of that, what a patient actually experiences.
Real world stuff. So
Right.
they learn hospital politics early on.
Exactly. That's a great way of putting it. So in here, this is set up for a transfusion reaction.
Okay.
But this is one of our double bedrooms. So you can kind of see we'd be able to separate nursing care, kind of simulate that type of an environment too. As we go around this core, you'll notice a lot of the same things as far as there's a head wall in each of the rooms, 2 for this one with the 2 different spaces. But then we have an actual kind of recording station for nurse educators. And then around the room, you'll see various screens. So these monitors up above the patient are really meant more as a vital screen.
Right.
We're able to go into the control room and display that up there for them. And then any educational videos we'll put on those larger screens. I don't know if you got a chance to see, but we do have a control room dedicated to each of these rooms. And in our control room, this is where, kind of as a technician or a stimulation operations specialist, you'd sit in the back, control the mannequin from here, all the different changes that are going on, be able to watch the learners, work with faculty on what changes they want to see based on the curriculum. And then up above here we have the CA Enterprise system, which is really just more so a overhead camera and announcement system that allows us to kind of patch into those rooms without needing to enter and break kind of the fidelity of the sim. So, as we head back, each of these rooms are very similar. This one I'll show you just because it is a little bit different. I think this is set up for emergency medicine course right now, so more so airway simulation. So
This patient is in rough shape.
Right. So basic to advanced airway, utilizing the video laryngoscope and that sort of thing.
Right.
But this room is really designed more so for nursing care, where you can actually take a patient to the bathroom and back. Actually, that bathroom, a little weird, but it's a demo toilet room, and inside it actually has cameras and speakers. So as the healthcare worker is actually moving the patient, we're able to identify, hey, are you using gait belts? Are you using, the typical things that we train on for safety purposes.
Right. Very cool.
Yeah. So yeah, as we can continue out kind of around this way, this is just a large U shape. Like I said, each of these rooms are pretty much identical as far as having a head wall. We've been changing them a lot more than we had expected, just because to accommodate for COVID and open up more space to spread people out. But other than that, they would be set up as more so inpatient hospital rooms.
Sure. So how many sim men or I guess is that how you're?
Yeah, no, the adult mannequins that you saw in that room.
Oh wow, is that a neonate?
That's one of them. Yeah, that's actually a pretty low fidelity one that comes out of a high fidelity mannequin for a birthing simulation.
Wow.
But as far as that goes, we do have 2 other high fidelity, an infant mannequin and a pediatric age mannequin.
Wow.
That are allowed to, they have the capabilities to blink, to speak, show an actual chest rise and fall, pulses, that sort of thing.
Wow.
So you can come around this way. So this is set up for, can't remember if this is like a gallbladder removal with allergic reaction to anesthesia or what the case is exactly, but it's something along those lines. It's for our anesthesia resident sims. So they come in and then they'll be able to go through and actually practice, treatment of this patient as he starts to crash. So,
Sure.
but yeah, everything in here is fully functional. The laparoscopic tower is the last thing that we're kind of setting up right now. We do have kind of more portable options as far as laparoscopic towers go, but that's really what this whole tower is for.
Very cool.
Yeah. And again, you can kind of see the different screens and the electronic medical record recording station. Out here is kind of the scrubbing area for each of the ORs have that. And then we're back out into kind of more so the welcome desk or space here on the 6th floor. And then one area I'd show you is, so you'll notice there's quite a few of these black doors around. And these are more so what traditionally simulation would consider debrief rooms. And what we've turned them into is what we call gateway rooms. But the idea is that for this room specifically, you can observe the ORs that are going on. But this is where you come in to get your pre-brief before doing the scenario, come back and do the debrief. And then with that CAE camera system, we actually pull up the live recorded feed of what you just did, and the instructor or the faculty is able to walk through those steps with you and ask you, hey, what were you thinking as you change the medication from this to this and that sort of thing.
Very cool.
Yeah. So we have, I think there's six of those gateways as we walk around. You'll kind of notice them. So those three are also. And then we'll head back to kind of these technology trainer spaces.